Hello, everyone. This is Richard from Modern Healthspan. Is the carnivore diet healthy? When I first heard of the carnivore diet, it seemed to me that it could not be. Though anecdotally, I have heard of people reporting that they feel really great on it. This study gathered data from 2,029 people who were on a carnivore diet and looked at some of their health metrics. It was not clinically controlled, but it is the first mainstream study to look at the carnivore diet, and it was run by the Harvard Medical School. So let's see what they found. What is the carnivore diet? It's a diet based on eating close to 100% animal products, and so removing almost all plant-based foods. It has grown in popularity recently, and it has not been much studied, and there is not much known about the health effects and tolerability, especially related to nutrient deficiencies and cardiovascular disease risk. The data was gathered through social media survey between March the 30th and June 24 in 2020 from participants who self-identified as eating a carnivore diet for at least 6 months. For this, they used a survey covering diet, health data, and other metrics. A total of 2,029 respondents met the criteria and entered the trial, of which 67% were male, with a median age of 44. Median time for following the carnivore diet was 14 months. The primary motivation was health reasons for 93% of the respondents. Red meat was one of the staples eaten daily. Under 10% ate any vegetables, fruits, or grains more than monthly, and 37% said they did not supplement with vitamins. There were few adverse symptoms reported, and these were gastrointestinal, muscular, or skin-related. The participants reported improved health and well-being and a reduction in medical conditions and BMI. With a high-protein, high-fat diet, there is a concern with the lipid panel, and there was some elevation of LDL, though HDL and triglycerides were optimal. For diabetes, there was considerable improvement in BMI, HbA1c, and the use of diabetic medicine. Contrary to common expectations, there were not many adverse effects, and instead had some positive health benefits, though cardiovascular risk was variable. Because of the nature of the survey, it was difficult to generalize from these findings. The paper has tables which detail the data for each of the points I will go through. If you are interested in these details, please go directly to the paper. We have linked to it in the description, and it is open access. The participants were mostly from the US, Canada, Europe, and Australia. 67% were male and 83% white. Interestingly, income spanned low, middle, and high, despite meat being generally more expensive than plant-based foods. On a caloric basis, it may be cheaper than non-starchy vegetables. Also, the protein leverage effect may be working, which would make animal-based foods more satiating. The median time for being on the diet was 14 months. The longest was actually 28 years. And 93% mentioned health reasons as the primary cause for taking up the carnivore diet. Drilling a little bit more into the hoped for health benefits related to starting the carnivore diet, here are the specific reasons. 84% were looking for improvements in body weight or composition. Other areas are mental health and focus, allergies, and diabetes. Some details on the diet. Most of the participants ate red meat. Pork, poultry, and seafood were less frequent. Organ meats, which are a good source of micronutrients that may not be in other cuts of meat, were eaten by 42%, and non-milk dairy by 72%. Although all the respondents were self-reported as being on a carnivore diet, some did consume a small amount of plant-based food. Also, 37% did not take vitamins, and 75% reported no other supplements, which is perhaps surprising given the possibility of specific deficiencies with such a limited diet. Drinking alcohol was not common, with 63% drinking less than once a month, although 50% still consumed coffee. Most did not eat fast food, which to me makes sense, because if you're going to make the amount of effort required to follow a carnivore diet, you probably care enough about your food not to eat junk. Most of the participants chose meat with high or moderate fat, which makes sense, as meat has almost no carbohydrates. So they are replacing this with fat to provide the energy. In fact, one point that the authors made in the paper was that the carnivore diet macronutrient mix is quite similar to Atkins or other ketogenic diets, so studies of these may be relevant for comparison. 41% of the participants focused on achieving ketosis and measured this. Given the low carbohydrate content of meat, it is possible that more than this were in ketosis but did not check. Here we see the results from the qualitative responses. There are very few that got worse. In some cases, up to a third saw no change, but most saw improvements. Potentially, the mental clarity, memory, and focus were because of being in ketosis a significant part of the time. And strength, endurance, and a lack of food cravings may be because of the diet being higher in protein. The next table is showing self-reported changes in chronic disease symptoms, though some of them are certainly measurable, such as body weight and blood pressure. The majority either were resolved or improved. This included obesity, blood pressure, and gut issues, particularly, as well as diabetes, which we will look at in the next slide. There was also a reduction in autoimmune and dermatological issues. Most allergenic foods are plant-based, and potentially removing these may be part of the cause in the reduction in autoimmune. Given that this is probably a higher protein diet, the improvements in the urological condition is interesting. There were very few that worsened or started new. The one that has mixed results is lipid abnormalities, and we will look at the lipid panel in more detail in a minute. Looking at diabetes and the medications taken to manage it, there was good improvement in most cases, with 92% coming off injected insulin. There were 16 participants with non-insulin injections, and all of them came off their medication. Although all the data is self-reported, this table does have concrete numbers from lab tests. The way to read the table is the blue columns on the right show the before results with the median quartile 1 and quartile 3 numbers. The red rectangle on the left has the same figures for the after. An asterisk in the median column means that the p-value was less than 0.01. Both weight and BMI improved significantly, although there are many other diets which help to lose weight. Being able to keep the weight off can be a struggle. At least for the period of time that they were looking at the carnivore diet, it did seem to be successful at this. Total cholesterol and LDL-C went up, which is common in low-carb diets. HDL-C also went up, and triglycerides went down, with both being in the optimal range. In the study, they note that although LDL-C is thought of as a risk marker for CVD, when combined with low triglycerides and high LDL, it may be because of buoyant lipoprotein particles and represent a low risk. Two other markers to improve were HbA1c and C-reactive protein. As mentioned before, allergens or compounds which cause intolerance are often plant-based and could cause inflammation. Potentially removing them is what helped lower CRP. The liver panel was largely unchanged, with improvements in GGT. There are, of course, some limitations with the study, and how much it can be generalized from. The data was all self-reported, and there could be many confounding factors. One possibility is that participants may have started the diet because of a health issue, which would have cleared up anyway. This, I think, is perhaps one of the main factors. If people had started a carnivore diet and found that it did not suit them, either for lifestyle or health reasons, they would have stopped and not volunteered for the survey. So the respondents are selected to be a group for whom the carnivore diet has worked. And finally, a person who chooses to follow the carnivore diet and respond to invitations to surveys is already selected to be a certain type of person. Someone who is motivated to follow a healthy lifestyle and avoid ultra-processed foods, for example. I was interested to read this study, as common advice is that a plant-based diet is the healthy option, which is what some of our guests have proposed as well. It's good to have another perspective. Just to be clear, I do not follow a carnivore diet, and I am not promoting it. Perhaps what we can take away is that at least for some people, the carnivore diet does seem to be practical and reasonably healthy, although it would be nice to have more rigorous studies. Thank you for your attention, and I wish you all well.